Good day to all of our panelists. I'm Acer Kel F. Delos Santos and my partner is Jude Vincent M. Ferrer. Our topic is Facility Design Improvement for the New Normal in an Integrated Production Distribution and Retail of Dental Products and Services. So this is an introduction, chapter 1. So retail industry. Retailing as a function is central to all economies. It bridges the varied needs of consumers with specialized offerings of producers. Traditionally, brick-and-mortar physical retailers have taken on this function most of the time. So, what are our retail industries used for the study? So, our model company that we use is Intercast Healthcare Corporation, which is a distributor and retailer of dental products and services to dental offices, laboratories, and dental colleges. The company has been serving the dental industry for the Philippines since 1972. So what are the challenges for retailers? So to make store-level retail jobs interesting to the different employee types, although retailers mainly focus their attention on career seekers, we find that working in retailing is interesting for all types of employees. So why is there a need for this study? Because of the challenges of retailers, which is the new normal during COVID-19 pandemic. As you can see here, we are experiencing the pandemic which affects our economy and also every business aspect in the situation as of today. So as you can see here, here's the bar chart, which is the about during April at the height of the pandemic, about 2% is open and about 21% is partially open, about 77% is closed. And during July, when the government eased the lockdown, about 5% are open, 40% are partially open, 40% is about closed, and about 15% is permanently closed. So this is the operating status of firms and top 10 sectors with most closures. So as you can see here, that the most affected sector is the arts and entertainment, which is it has about 61% closed and about 21% permanently closed, which the survey results indicate that the community quarantine had a significant temporary and permanent effect on the operational status of firms. So as you can see here, this is the impact on employment and compensation in July compared to April 2020. So as you can see here, here's the 1% increase, about 37% remain the same, 48% decrease, and about 52% reduced payment to employees, which is close to 48% of firms reported that they reduced the number of their employees. So here are the challenges for the retailers, which is first is the COVID-19 outbreak. And also this is becoming a problem, especially for the manufacturing industries and other services, especially to retail industry, as direct physical contact is common and needed in a daily basis. So here is the problem statement, which one of the companies that had been greatly affected because of the pandemic is Intercast Healthcare Corporation. Intercast is a distributor and retailer of dental product nationwide. Their daily operation had been influenced as a result of new regulations, such as health and safety protocol that is mandated by the government that causes delay of distribution of their products to the consumers and late delivery of their supplies because they acquire it internationally. In addition to that, they are in the dental industry, which means there is a high possibility of transmission of the virus because their clients need to have a physical contact to their patients. And to mention that there is a decrease of total number of sales for the reason of that there are fewer people who go in dental clinics as a safety precaution. So here is our objective of the study. The number one is to identify the issues or problems encountered by Intercast Healthcare Corporation in terms of facility management system, considering that new normal during a pandemic time. Also, the other objective of the study is to improve facility management system of Intercast Healthcare Corporation to adapt on the new normal during a pandemic time. So here is the scope and limitation. Due to the COVID-19 pandemic, the researchers only focus on Intercast Healthcare Corporation as a model company for the study because of the lack of the availability and information, and also out of all the retail distribution that we have contact, only Intercast Healthcare Corporation responded.
Hi, I'm Jude Ferrer, and now I will talk about our methodology for Chapter 2. So, for the methodology, the whole chapter presents the research structure, analysis methods, population and measurement, data collection, and statistical resources. Also, the researchers' objective frameworks are seen in this part of the research. For the specified retail industry selected for this study, the researchers used Intercast Healthcare Corporation, which is a distributor and retailer of dental products and services to dental offices, laboratories, and dental colleges or schools. So as you can see on the slide, this is the logo of Intercast. So for added information about the Intercast Healthcare Corporation, the company has been serving the dental industry of Philippines since 1972. And Intercast has international suppliers to make sure the quality of their products as well as services that cater to the specific demands of each community. They also have 150 dealers nationwide to ensure that every needs is being taken care of. So the general manager oversees the 11 departments, which are the following. So these are the intercast departments, uh, namely cash department, accounting department, purchasing department, HR department, sales department, labor department, warehouse department, logistics department, technical department, IT department, and the last is utilities department. On this slide, it shows the process that happens on the company. As for its operations, since COVID-19 outbreak has started, there are few restrictions since there are less manpower and late deliveries due to limited transportation and shortage of stocks since the company has international suppliers. So this is the business process of Intercast Healthcare Corporation. So for the Intercast distribution schedules, first one is daily for Metro Manila, then every Thursday for Northern Luzon, every Friday for Southern Luzon, and every Monday for Mindanao via Roro. So since the paper will focus on the facilities improvement, their warehouse and office are on the same building. So let's talk about Intercast warehouse layout and floor plan. In here, it shows the layout of their warehouse, which stores their products and supplies. It has 4 counters. Each counter handles up to 2 different product line, and there are about 40 racks. So, as you can see on the slide, this is the warehouse department layout of Intercast Healthcare Corporation. So there are 12 staff present in the warehouse as seen on the figure in this slide. So these are the warehouse manpower. The first one is warehouse manager, and below the warehouse manager is the warehouse assistant manager of Intercast. And below the assistant manager are the inventory clerks and pickers. Inventory clerks and pickers for clinical consumables, for laboratory consumables, for clinical equipment, for laboratory equipment, and for spare parts. So in this slide, we can see this is the warehouse floor plan of Intercast. As you can see on the figure, there are spaces for storage, for pantry, and for the fire exit. So for the next slides, I will show you the actual picture taken on the company. As you can see, this is an actual pictures taken from the warehouse of Intercast Healthcare Corporation. The warehouse is currently not organized and there are boxes everywhere. And in here, as you can see, this is an actual pictures taken from the office of Intercast Healthcare Corporation. So let's go over the objective frameworks of the study. I will discuss them one by one. For the objective framework 1, as you can see, there are input, process, and output. So for the objective framework 1, to identify the issues or problems encountered by Intercast Healthcare Corporation in terms of facilities management system, considering the new normal during a pandemic or COVID-19. So as you can see on the input, current facility layout of Intercast Healthcare Corporation and observation of the current process map of Intercast Healthcare Corporation. So for the process mapping, how analysis, and why analysis. And for the output, the expected outputs are root causes and issues and problems of Intercast Healthcare Corporation facility layout. So for the next slides, I will discuss the IPOs of the Objective Framework 1. So the first input is facility layout. So the researchers use this tool for an organization to have a successful and effective assembling unit. It is significant that extraordinary consideration is given to office design. So the physical layout of a retail store is known to influence the attitude and behavior of shoppers and affect store performance. So the next part for the input in Objective Framework 1 is the current facility layout and floor plan of Intercast. So this part is included on the process for Objective Framework 1. So this is the current process of Intercast. So a process map is a tool for organizing and executing which visually represents workflow. Business process mapping is an effective tool within dental products and services retailers. So the researchers use this methodology or tool to physically map out corporate procedures so that any shareholder in the company would appreciate the correct functioning and stick to it. Yes. So for the next part on the process, uh, YY analysis. So as illustrated, the YY diagram is designed for evaluating poor operating performance. So in this slide, we can see the example of a YY analysis. The next part for the process is how-how diagram. So the how-how diagram functions by consistently posing a similar inquiry of an issue, separating the arrangement into an ever-increasing number of express components. So as you can see on the picture, this is an example of a how-how analysis. So let's go on the objective framework 2. So our objective framework 2 is to improve facilities management system of Intercaste Healthcare Corporation to adapt on the new normal during a pandemic. So for the input, process, and output, the input, assessment obtained from objective 1 output, and problems and issues seen in layout. So for the process, we will use the SLP or systematic layout planning. And the expected output for this objective framework is improved facilities management system for Intercaste Healthcare Corporation. So we can see on this output the new layout for the new normal during a pandemic or COVID-19 and new policies and procedures for the new normal during a pandemic or COVID-19. So this is the process to be used in Objective Framework 2, which is the SLP or Systematic Layout Planning. This is a way to optimize the retail design layouts concerning product type and quantities, study of the movement of products and components and layout relationships, and the relationship between the appropriate spaces and each other for each layout procedure. That's all. Thank you.